Newsday continues here on One News Now. I'm Charles Lejano. Fishermen in the West Philippine Sea have revealed to foreign journalists that they continue to experience harassment by China in our own waters. But the palace has dismissed these claims. Spokesperson Harry Roque says he's even ready to go to Panatag Shoal to prove the reports wrong. Arian Kalumbiran with the report.
It has been 5 years since the Philippines won its historic case against China over the West Philippine Sea. But for fishermen from Barangay Cato of Infanta, Pangasinan, not much has changed since then. Fisher folks say they still feel unfree to do their operations at the Scarborough or Panatag Shoal. It was in July 6 when news agency Reuters interviewed the group of Christopher De Vera just moments after he went on a fishing trip. De Vera narrated that ever since the Chinese Coast Guard was stationed in the area in 2013, Filipino fishermen have become afraid to go to their usual fishing grounds.
Hindi pa pinakalaman ng China yan, grabe talaga. Yung hindi ka abutin na isang linggo dyan, yung 4 na tonelada, 5 tonelada, hindi ka abutin isang linggo dyan. Wala na, kahirapan na. Banya-banyera, minsan timpa na lang.
Randy Megu is part of Christopher's team. For Randy, the government is not doing enough to protect Filipino fishermen. He also believes that the Philippines' arbitral win against China did virtually nothing to improve their situation.
Nanalo nga tayo pero ang problema dito, bakit hindi naman inaasikaso ng gobyerno po natin? Dapat nga po sana ito, dahil nanalo naman po tayo, dapat sana sila po yung nagbabantay. Yung mga Navy po tulad po ng sinabi ni Sir Chris, mga Navy po isara dapat natin, tsaka yung mga Coast Guard po natin dapat ang nandoon, hindi yung Coast Guard po ng China.
Randy also claimed that until now, Filipino fishermen experience harassment by the Chinese Coast Guard.
Talaga natakot talaga kami, sir, kasi yun nga, minsan hinahabol kami ng rubber boat. Tinataboy kami palabas. Tulad ng mga nakaranas ng pangharas, binawater cannon daw po sila. Problema dito sa amin is sarili nating palaisdahan. Kami naman po itong takbo ng takbo. Parang ang ano namin is para kaming nagnanakaw sa sarili naming palaisdahan dahil hindi naman kami pinapayagan kuminsan ng mga Chinese Coast Guard.
Randy fears that fishermen will soon lose their livelihood, not just those in their area but also others who heavily rely on the waters of the West Philippine Sea for their daily catch. This July 11, the British Broadcasting Corporation or BBC released a report called Our World, the Battle for the South China Sea. This report tackled the harassment experienced by Filipino fishermen from Masinloc and Bolinao every time they fish at the Panatag Shoal. This report did not sit well and was questioned by the palace. In a press briefing aired on national television Wednesday, spokesperson Harry Roque even dared one of BBC's journalists, Vilma Rivera, to call him to discuss the report. Mayors from Masinloc and Bolinao even made a virtual attendance during the briefings to deny the claims of fishermen interviewed by BBC.
If you care to call us, Vilma Rivera, please do so. We will link you up with them nang malaman natin kung sino talaga ang nagsasabi ng katotohanan.
On Thursday, Roque also used some time from his press briefing to show some photos of the Philippine Coast Guard with a few fishermen in the West Philippine Sea. These photos, he said, were taken on Wednesday.
So sa tingin ko naman po, malinaw na malinaw. Nakapangingisda po ang ating mga kababayan at nandun po ang Philippine Coast Guard kung merong abirya sa ating mga kababayan.
Afterwards, Roque announced that he himself will go to the Panatag Shoal and the Kalayaan Islands in Palawan to see for himself the situation of fishermen.
Matagal ko na pong gusto makarating dyan. Bago matapos ang termino ng Presidente, sana magkaroon po ng katuparan. Pero pupunta po ako dyan dahil gusto kong pumunta, hindi dahil meron pong paghahamon ng kahit sino.
Arian Kalumbiran, we are One News.
US-based firm Simularity says they regret using the 2014 photo for their report on China's supposed waste dumping in the West Philippine Sea. But the firm reiterates that their findings are authentic and aren't based on that photo. Mobile journalist Stanley Gahete gives us a front seat to the story.
Special. It was for context because it's really hard to see that and understand it from the satellite imagery. That's why we put that image in there. At this point, I do regret that.
That was Liz Dare, CEO of Simularity, a California-based AI-based geospatial intelligence company. She said the picture in the report about Chinese ships damaging the environment in the West Philippine Sea was a mistake. But she is standing by her company's report after Philippine officials doubted if the environmental waste dumping is true because of the wrong picture. That image about a ship taken in 2014 at the Great Barrier Reef in Australia has created confusion.
I put that picture in there because it is nearly impossible to really grasp the situation when you're looking at little gray dots on a satellite image.
There said there are scientific proof about China's waste disposal in the Spratly, not only images from satellite.
That this is possible and this is how you do it in terms of measuring the chlorophyll.
On Monday, Simularity released public satellite images based on a 5-year period showing damages caused by untreated human waste from Chinese vessels. The Philippines is now verifying Similarity's report by sending Coast Guard and Bureau of Fisheries teams to Union Banks where the China ships are anchored. But there said she's not the best person to propose what would be the next move.
I wouldn't pretend to know exactly what the right thing to do is that would solve all of this situation.
There is only one problem. Can the Philippines drive away the Chinese ships from disputed waters? There has a message to Chinese ships in the area.
Anchor somewhere off the reefs. When you need to dump your waste, go move and dump it somewhere away from the reef.
She also has a message to doubting Philippine officials.
We've done this from space because that's really all anybody can do right now because that area is so militarized. Understand the science and see for themselves.
I am Stanley Gahete and we are One News.
The Health Alliance for Democracy is once again giving the Duterte administration a failing grade for this year. The group says this because of the national government's poor COVID-19 response. President Duterte should be removed from his position, and they lamented that if the government was able to improve the healthcare system in previous years, we wouldn't be having a hard time during the pandemic.
Pinatunayan naman po ng mga pangyayari nitong nakaraang 5 taon na wala talagang naging pag-angat sa kahit man lamang sa kalagayan sa paggawa ang ating mga manggagawang pangkalusugan. Nahila pa nga sila doon sa krisis na ito. Kaya hindi ho namin nais na magpatuloy ang administrasyon na ganito, na wala talagang sinserong pagmamahal sa taong bayan, walang sinserong pagmamalasakit sa mga manggagawang pangkalusugan.
And for this year, binigyan po uli namin siya ng, sabi nga namin, sabi ni Dr. Mike Tan, ay F squared or palpak na palpak. So, ganyan po ang ating rating kay Presidente Duterte sa kanyang administrasyon. Palpak po, talagang bagsak na bagsak kung sagrado. At kung bumagsak na po siya last year sa ating assessment, ngayon bagsak na bagsak ka rin.
The Health Department says they've already been preparing for the possible spread of the highly transmissible Delta variant. On One News is the Chiefs. Health spokesperson Maria Rosario Vergeres said the agency has already learned their lessons from the local surge of cases earlier this year. In preparation for a possible Delta variant surge, Vergeres says the DOH is now working on improving the health sector by expanding hospital capacity and readying more oxygen supply. She also said communities need to be coordinated in terms of prevention, detection, isolation, and treatment. The agency also expanded its one hospital command center at the PICC, hiring more call agents to accommodate more patients should a surge occur.
Well, it's going to be really difficult and a challenge because the characteristic of this variant, the Delta variant, it is 60% more transmissible than the UK variant. So sabi po ng mga eksperto natin, kung dati ang UK variant can infect, ang isang taong may UK variant can infect about 2 to 3 individuals, dito po sa Delta variant, it can go as high as 5 to 8 individuals na matatransferan or mai-infect nitong taong may Delta variant. So that in itself would really be a challenge kasi talagang mag-exponentially increase yung mga kaso dito sa ating bansa kapag nakapasok yan.
Authorities are now looking into the selling of overpriced COVID treatment drug remdesivir. This as patients report being asked to buy the drug for as much as 30,000 pesos per vial. Marlene Alcaide tells us more.
Rosa's 81-year-old mother passed away last April due to COVID-19. but her family still continues to pay the 1.2 million peso hospital bill for her mother's confinement in the hospital. A big chunk of it went to remdesivir drugs that, according to Rose, are overpriced.
Masakit na hindi mo maintindihan yung bang walang-wala na nga kayo di ba? Tapos magdidiman pa talaga sa mga ganyang sistema. Tapos yung mga gamot, lahat ng mga gamot, yung mga remdesivir, yung mga price nila, lahat, doble lahat ang mga price nun. Nasa naman, wag naman sana nilang yung mga pasyente. Kaya nga kami lumalapit sa mga ospital, sa mga na sana makatulong man lang sana sila sa amin, lalo nilang kaming nilulubog, lalo nilang inaano yung mga pasyente. Konsiderasyon na lang ba kahit papaano?
Meanwhile, Maria, not her real name, and her husband contracted COVID-19 as well. But unlike her, he also suffered leukemia. One of the problems is their 15,000 to 20,000 pesos daily payment to a different hospital. This was aggravated by having to pay for overpriced remdesivir drugs.
Nakita ko po sa TV na yung SRP po is parang 7,000 to 8,000 lang. Tapos yung binayaran ko po 14,000 plus.
Per vial.
Opo.
According to the NBI, PhilHealth have noticed the trend and ordered an investigation on the alleged overpricing of remdesivir.
Ayon sa PhilHealth, upon audit ng kanilang yung cost ng kailangan nilang mabayaran, napansin nila na bakit ang taas ng babayaran. Ngayon na upon audit, nakita nila na yung remdesivir nga is overpriced. So may idea kasi ang PhilHealth kung gaano lang ang cost ng yung remdesivir na gamot. May mga patients na pinagbayad ng hospitals ng panahon ng April 2021 na umaabot ng 15,000 at meron pang nasingil na 30,000 pesos per vial.
Remdesivir is being used as COVID-19 treatment via compassionate special permits released by the Food and Drug Administration. Based on the DOH suggested retail price released last April, remdesivir drugs should only be around 1,500 pesos to 8,200 pesos. News 5 still waiting for the two hospitals' comments on the matter. Meanwhile, the NBI also pledged to investigate other patient complaints, such as asking for deposits before admitting to the hospital. For News 5, Marlene Alcaide, we are One News.
Boxer Marcial will replace pole vaulter EJ Obiena as the Philippines' male flag bearer for the opening ceremonies of the Tokyo Olympics on July 23. Philippine Olympic Committee President Bambo Tolentino told the Philippine Star that it would be more convenient for Marcial to carry the country's colors because he will be arriving in Tokyo over the weekend, whereas Obiena will be arriving in Japan from Italy just hours before the opening ceremony. Tolentino added that because of protocols, EJ might be hindered by delays at the airport, which might make it impossible for him to catch the opening ceremony. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.